Okay, what's going on, everyone? It's Dr. Jordan Seda coming to you live from New York City. Are you ready to go to health and back? All right, let's get it. All right, everyone. I'm pleased to be joined here today by a longtime friend and colleague who I have to create opportunities like this to even get FaceTime with because he's such a busy guy. Dr. Lee Scantalides, what's going on, Lee?
Hey man, what's up? I'm so happy to do this, and thank you for having me on. This is great. This is a huge thing. I think that getting into podcasting and getting your voice out there, and I love to be a part of it.
And there will be no one I'd rather have. I mean, I probably said that to other guests that I'd rather have nobody else, but for you, definitely, you've been instrumental to my career growth, and I hope people can appreciate why that might be. But yeah, we've had a hell of a year. I was actually able to buy a home COVID test today, which is bananas. Like all the pharmacies were sold out since Tuesday,
Yeah. Oh my
and
God. Where did you
yeah,
go? You were in the city and got one?
yeah. All right,
Oh
so
my
for
God.
everyone who needs a home COVID test in the city, the Dwayne Reed on Broadway, and I want to say, okay, so it's right next to the Trinity Church. They are not
Oh my
short
God.
on COVID tests.
That's
It's
incredible.
amazing how something that was preventative is now being used for capital gain, but that's for another podcast episode.
Oh my God.
Might have to pull like a Russell Brand or Joe Rogan and go in on capitalism and disease.
Please don't.
I will not do that. But anyway, so let's dive right into it. Like I said, Lee's been not catastrophic, a catalyst to my growth. And I want Lee to tell, or Dr. Skin, can I call you Lee? Or can I call you
Call me
Doc?
Lee. Yeah, I'm
All
good
right,
with Lee.
all right, Lee, just tell all the listeners a little bit about your background and what made you so awesome.
Well, first off, thank you for the kind words, man. I appreciate it. Yeah, so I've been a physical therapist for 11 years now, strength coach for about 22 years, and kettlebell instructor for about 7 years. Overall, I think the biggest thing that's always been in the background with me is martial arts. I've been doing martial arts for a long time, about 35, 36 years. And I love to integrate kind of the principles of all of those things into everything I do. So mainly treating patients through physical therapy, using things that I know about strength conditioning and kettlebell strength conditioning, and then also principles of martial arts. So I work with a partner of mine in the city in Midtown. And so I see patients there in an outpatient setting. And I also do kettlebell classes about 3 days a week at a jujitsu and Muay Thai studio in the city. And then I see strength conditioning clients virtually and in person.
It seems like
Yeah.
you have a lot going on right now. That's pretty solid. And I really need to make it to your kettlebell classes because it's like 5 minutes away from where I live.
That's right. It's so close.
Yeah, we gotta make that happen sometime. But we'll
Absolutely,
save
man.
everything for 2022 going strong on our
That'd be awesome.
resolutions and goals and everything. But I
Cool.
know part of what makes you great is that you really dedicated much of your professional career towards education. Aside from taking me under your wing, I don't know if it was the left wing or the right wing, but taking me under your proverbial wing, you started teaching at Toro University, or is it Toro College, or is it a
Tour
university?
College.
Okay,
Tour College.
Still
There
Toro
is a
College.
tour. Yeah, there is a tour university, but I believe it's out of this country. I think um I don't know where it is, but I know Tour College. That's the main college that I work for, and not only they in New York, but they're also in Nevada, and I want to say in California too.
All right, but
Yeah.
you're working at Toro College, and you're no matter what you're teaching, Lee is
Yes.
teaching. So tell me a little bit about what you have going on teaching. I know this we're still in this pandemic here, so you've had a lot of challenges, but just tell me about your overall experience with that.
Yeah, so I started in 2019, and I'm an adjunct instructor and I teach therapeutic exercise. So in 2020, the pandemic happened. It was only my second year doing it. And we had to shift everything around for sure because most of the sessions were virtual. And so this therapeutic exercise, as you can imagine, is extremely lab heavy. So we had to do essentially create virtual labs because half of the courses were virtual and the other half were in person. So we tried to do virtual labs plus lecturing virtually, and then when we came back in person, we did all of the rest of the labs, which was, I think, I think it went over okay, but I think it was very tough. And then in 2021, it was also the same thing, but we didn't have to do as many at the time.
Lee, you're cutting in and out.
Yeah,
Yep, there we go. I might have to go back and rerun that. So tell me a little bit more about, because you cut out there a little bit. I don't know why.
I did. Here, hold
Yeah.
on 1 second. Sorry about that. Cool.
So Lee, I know that one of your passions, aside from taking me under your wing, whether it be the left or right wing, I'm not exactly sure, is to educate younger clinicians and more recently, physical therapy students. So tell me a little bit about what your experience has been like educating people at Toro College here in New York City.
Sure. Yeah. So since 2019, I've been an adjunct instructor teaching therapeutic exercise at Toro College. And so 2019 was a normal year, as you know. And then 2020, when that hit, we had to totally shift around our schedule. And at least half of our classes were virtual. And so that was pretty tough because we had a very lab heavy course, therapeutic exercise. We needed to do nearly a long lab each class. And so we would do virtual labs during the first half of the semester, and then the last half of the semester was all clumped together with a bunch of labs, and with also our midterms and finals. So yeah, it was definitely tough. And in 2021, luckily, we only had to do one virtual class, and then the rest were in person. And we had strict mask wearing and social distancing as much as we could, with the versus the partner work and things like that. So yeah, it was very interesting the last couple of years.
But I'm sure you've become a master at, what's the word I'm looking for? Innovating, working on the go. And it seems like I haven't heard a decrease in percentage of people passing the boards recently. So things must still be working.
Yeah, what I heard through my the director of the program, she mentioned in 2020 we were one of the few schools that did not delay graduating students because we still were able to adapt a half and half system, and then we did a lot of virtual stuff. So we were still able to meet the guidelines of what the boards would recommend or require for us to certify someone to graduate and then sit for the board. So I was happy to hear that. And I would agree with you. I feel like, almost all the schools here in the city, at least, have adapted and have been able to pass on the coursework to the students in some sort of way that was still effective.
Yeah, that's amazing. And my last guest that I had, for those of you who listen to Dr. Marcus's podcast, there is going to be a continued increase in people going through physical therapy programs looking for work. So it's not like the programs are getting any easier. They're actually getting more challenging, and the quality of student that's getting accepted to PT school nowadays is quite special. So to that point, I know back in the day we used to have a joke at Columbia, and I don't know if they want me to say this on air, but it was like, if you didn't get accepted to like the top schools that you applied to, Columbia would take you if you were like a decent person.
Oh
You'd always
man.
hear you would hear some rhetoric. Not to, I don't want to water down my degree by any means, but it was like, oh, if you have a 3.3, but you have like a killer resume and a solid GRE score, they would take a chance on you. Whereas nowadays,
Wow.
I gotta stop saying nowadays. Recently, I've heard that would not fly on an application process. So you're getting students that seem uh, better prepared to deal with the rigor of a graduate level program. And with that, I think I'm also noticing more students asking questions and challenging things that are being taught to them, which is definitely different than even when I was back in school. And you've been practicing considerably longer than I have. So tell me a little bit about the change you've noticed in contemporary students relative to those when you were a student like yourself.
Yeah, a huge difference. I mean, just thinking about that now, like I've known a couple people who've recently gone through the application process. One friend of ours, my wife and I's friends, and then he got accepted in a PT school. Totally different process from when I did. Just that alone, the application process and how everything has to be on point, even like your GRE scores, because there's so many people applying to PT school, and you have to be kind of really top notch to get accepted, at least from what I understand here in New York. Um, and then the actual student, once you get in, very different. You know, when we were in PT school, I was in PT school 2007, 2010. The main curriculum had nothing to do with pain science, very little, or I wouldn't even say any strength and conditioning influence. And then social media wasn't really a thing. The first iPhone came out in 2007. That's when we started school. And so, like, you know, there wasn't really apps or anything like that. So now you have Instagram, you got YouTube, Twitter, the sharing of the research on all those platforms. So now the students who come in and they get into the program, not only are they like top notch with their academics and their extracurricular activities, but they're also usually well versed in knowing what pain science is, or at least aware of what that is in comparison to like pathomechanical, pathoanatomical models. So that has totally, in a good way, I think, at least for myself, has forced the instructors to really be up their game and bring up-to-date research, bring what they found in the clinic, and see if it matches what they have questions for. And I get a lot of questions every year, a lot of great ones about what we're teaching. And then the students have really good discussions with themselves. That's one thing I've noticed that I loved. But yeah, it's very different from when I went to school.
Yeah, but you're definitely someone that does embody staying up to date with the evidence and evolving with the changing times. Because, you know, I can attest because I'm also Lee's patient, aside from friend, buddy, guy, you insert other things, colleague. So I can attest that he understands how to approach rehab from a more, I mean, you could say biopsychosocial model, but most of you are like, what the fuck does that mean? The people that are listening. So basically, just like taking into account what someone like myself needs in my daily life and what my physical capabilities are, and any barriers that would prevent me from getting there. Which, you know, I know when I was first starting as a physical therapist, I thought those things were important, but I just wanted to get my hands on people, move some bones, release some tissues with all the force that I had, and I was gonna make some significant changes with my hands. But I've seen my practice change where I'm now more of a movement-based therapist, and I think you're also there. So tell me about how you have undergone flipping the script from more of a manually based provider to where you are now.
Yeah. Oh man. So like, you know, going through the traditional schooling, getting out 2010, and then practicing, I did my last affiliation in a very heavily manually oriented clinic. And so that's what I was looking to get into. And I was kind of thinking the same thing. All I wanted to do was, you know, get my hands on patients and, you know, move bones and treat fascia and learn as much as I could about that. And then I would say like 2 years in, after taking multiple Con Ed courses, it literally came down to one physical therapist. His name was Patrick Lyons. He was an Australian physical therapist who worked at the clinic that I was at. He had at the time probably about 5-8 years of clinical experience at the time. And he was an incredible manual therapist, an incredible clinician overall. I looked up to him as a mentor for sure. And I remember after one day of treating, he was like looking at his iPad obsessively, and he was just like kind of clicking through this thread or this forum. And I was asking him what it was, and it was this website called Soma Simple. And he was explaining what it was, and I still didn't really understand it, but it was just a group of pain scientists, or like some website that they can go to and have these discussions and share research and things like that. And that was kind of pre the popularization of like Twitter and I think social media as well in terms of sharing these things. And so he said when he went on there, he asked a couple questions to the main people who were holding these discussions, and this is his words, he was getting destroyed in terms of science and research about backing claims against what he was saying. And I was just fascinated by this, but at the time I was also like in this mindset of like none of this stuff really matters to the treatments that I do. And then over time, over the next couple of months and going into 6 months, he would try to like at each one of us that would work with him, each one of the therapists, he would try to influence us a little bit and ask us why we were doing what we were doing with certain patients. And then it came to the point where I came in after taking a weekend course through the Institute of Physical Art, or IPA, and I took their core first strategy course, what used to be called the CFS, and that was all about posture and strength and posture and how pain is correlated with poor posture and all this other stuff. And I was going to do an in-service to the clinic he was at, and so I did it with them, and it went over well, and I worked really hard for the in-service. And then he started a thread after that via email about asking, the what I think is happening when I implement these techniques. And then that sparked a conversation via emails with all the other therapists, and he was bringing in what he learned from the Soma Simple group to this thread, and I was just blown away because it was just like everything against that I've ever done. And then that was, I would say, that was the start. That whole experience with him was the absolute start of kind of rethinking what I was doing, and my principles started to change a little bit, and I started to see patterns in patients that I was not doing well with, in a sense that I would do all the manual work like crazy. They weren't getting better, and they would have these, particular things about their history that I didn't address yet. And then I started to, when you start learning these things, you do the fire hose, right? It's you start talking to patients about too much information, like, oh, when you have stress in your life, that's going to increase your pain. That doesn't help anybody without any context, right? You have to have some context to it. You have to have follow up, and I wasn't able to do that at that point. So my initial entry point to it was very rough, and it wasn't successful. And I would say by now I'm getting better, but it's obviously, as you know, it's always a learning process with each person, and it definitely more movement based, and really trying to integrate more and more just my own experience as a strength conditioning coach and kettlebell work and things like that with patients.
Very, very interesting how your path has manifested to today's work. But I know that you're definitely effective. Otherwise, I wouldn't spend my time and money even talking to you right now, let alone letting you address my bodily injuries, which are plentiful. Because everyone knows by now that I do capoeira. It's more than just a passion at this point for me. I think I'm skipping ahead. I wanted to say something about your influence and how it came to be, about how you can't just douse people in new information without context. That is so true. And I want to leave a disclaimer in here that I don't think Lee is saying that manual treatment has no purpose. I'm pretty sure he would adamantly disagree with that statement. But it's just that traditionally over the years, I think we're seeing a shift from providers who are addressing every bodily injury with manual therapy, but instead are now using manual therapy as just one of many potential tools for intervention, aside from prescribing exercise. But a lot of it is just lifestyle modification. It could just be a simple change in someone's belief systems or getting into better habits that will lead to longer term health gains, instead of that. I don't want to say traditional chiropractic model, but I hate to say it, it still kind of exists, where it's like you get cracked and then you see your chiropractor pretty much once a week for life until you're fed up with it or you're broke, or they raise your rent in New York City like they're doing with me right now, and then you're like, well, shit, oh, dude, you don't even want to know.
I can't even imagine.
Yeah, I might be Well, let's just say I might be seeing you less for a little bit. But anyway.
Oh man.
um, so yeah, so I do capoeira, going back to it, and I actually just got into gymnastics. I don't know if you've seen, I'm doing some tumbling classes and stuff now. Yeah,
No, that's awesome. I love that
yeah,
stuff.
yeah, I'm doing that. So definitely plenty of opportunities for me to fuck my body up as always, which you're my guy. But one of the things that you give me, and because you are a martial artist yourself, you give me a lot of kettlebell work to address my injuries, which I also really appreciate because it's great at isolating segments, and also isolating one side versus the other. So you, as a Brazilian, you're currently practicing Brazilian Jiu-Jitsu primarily, and you probably work with most of that population. How have you managed to utilize kettlebell training in their rehab successfully?
Yeah, this is a question I get a lot. Like, even from patients who are non-martial artists, they're like, "Why are we using kettlebells versus dumbbells?" And I think there's a number of reasons for sure. But the kettlebell training, it matches a lot of where our deficits are, obviously in life, but martial arts in particular, where like the staples of kettlebell training are things like swings, and even get up. So like those are the two main things that I think about when I can to help define kettlebell training. So swings is really, well, I would say any kettlebell ballistic is a huge heavy emphasis on explosive hip extension, that really helps you train both the hinge position, but also how to use your hips in a whole body motion. So anything that involves kicking and punching, someone who punches really strong, they don't have huge arms and they're not super strong upper body. The main reasons they can punch really strong is because they're really efficient at producing kinetic energy with their whole body, and that's primarily through the hips and the feet and rotation of the trunk. Same thing goes with kicking, same thing goes with throwing. So I think kettlebell training, when you dive into the main part of what is kettlebell training, then you learn about all that. You learn how to clean the kettlebell, snatch, swing, and then when you get to the grinds like the press and the get ups and squats, then you learn more about the strength aspect of it. Um, so yeah, I think in terms of rehab, it's a great introduction because it's in my opinion, and many will disagree with me when I say this, it's a very non-threatening way of introducing load. And the reason I say that, and I say this to my students, is when I want someone to learn the deadlift and actually lift load off the floor, sometimes if I put them in front of a barbell, they usually have a little bit more preconceived notions about injury and pain versus putting them in front of a kettlebell. Now, that could work either way based on their own experience if they had a bad experience with kettlebell training, but the kettlebell in nature is almost like a bag. They're used to picking up a bag off the ground. There's a handle to it, and you can put it between the legs, so you don't have to worry about a traditional, like conventional deadlift where your arms are farther out, and that might put a little bit more stress or strain, or put them in a position they're not comfortable with. So same thing goes for squats. You can hold the kettlebell in front versus putting a bar on your back. So I feel like for rehab, it's a great introduction to just moving around load. I bet you've seen that. It's I'm going to call it a corny commercial about being strong around the holidays, about with the old guy and the kettlebell. It looks like it's like in Russian or something like that, or Germany. But Adam Meekins has posted a bunch about it. This is the second year in a row he posted it for the holidays. But basically, it's an older person who they highlight him living by himself, and he kind of looks upset and not happy. And then he goes out to his garage and he moves all of his stuff around. He finds a kettlebell and he starts to just lift it up and down, and he can't lift it above his head. And that somehow is his goal. And then you learn after watching him do it day after day, and he's finally able to do it. He goes to a Christmas holiday with his family. He just wants to lift his grandson up to put the star on the tree, and so he wants to be involved in that. So it was like a whole thing about getting stronger functionally for something that's meaningful for him. And now, reason why I'm bringing that up is because it was a kettlebell. It was a very simple tool. He just used that for his training to help him get to his goal. And I feel like the kettlebell has so many things you can do with it, and it doesn't take up a lot of space. That's one reason.
Yeah. Man, I really miss being a clinician next to you, because I would hear all these explanations and then see it in real time. And man, I feel like a stupider clinician now that you're not around as much, only because you're saying all these things. And
Please.
now, do you think that kettlebell training is appropriate for people that aren't? I mean, I think you talked about the older gentleman in the commercial, but is there anyone that would not respond well to kettlebell training?
Yeah, I would say if they have a particular negative history with it, then that would be something that they would have to get over. Meaning, like, I've had patients who outrightly said, like, I've injured my shoulder because I did kettlebell work. And when I would bring it up, they would not be comfortable using it. So we would go right to the dumbbells. We got to meet the person where they're at and introduce load somehow, some way. And then maybe in time they would feel more comfortable with it. But if that person came up to me and, you could really tell that is what their history is, then I'm not going to force that on them and like try to convince them within session that that's not true or whatever. But yeah, otherwise, like all this work that I don't know if we've talked about, you do follow the kettlebell physio, right?
Yes.
So Neil May from Australia, he just came out with most of his work this year, and it's incredible because it's all about the older population kettlebell training, and he's got a great amount of data. I think it's 4 different studies. He looks at like bone mass. I think it was also muscle mass, strength, explosive power, and grip strength and things like that, and a very thorough review of all those things. And the whole point being is that he was, I believe, trying to show that kettlebell training is appropriate along the entire spectrum. And I think a lot of people think that with the older population, kettlebell training is not appropriate. And he had people in their 70s doing swings, which I thought was incredible. I mean, I have a couple of clients who do that now who are around that age, but we've been working together for a very long time, like years. So I thought that was great. It's a great thing to check out.
I think one of the major complaints in my experience as training people to use kettlebells, in the rack position, they tend to complain of discomfort on their wrist. Now, is that something that you would say they have to adapt to, or something that you should either modify the kettlebell load that they have or wait and try it again another day? What would be your advice if someone was complaining about discomfort on their wrist?
Yeah, it's a great question. Very common. I encounter that a lot, especially with people who have never done kettlebell work. So it's usually one of 2 things. One, the weight could be a little too heavy for their tissues at that moment. And then 2, and this is a complete hypothesis, I don't know if this is true or not because it's so hard to study this, but I do believe that there is a whole thing with threshold training with our skin and the muscles, especially in the forearm and the shins. So think of like Thai boxers, right? There's like this myth with Thai boxers that they deaden the nerves in the shin just so they can check kicks easier and the shins don't break. But I think what happens is, and I don't believe that's true, I think they train so much and the tissues become so tolerant of the impact that there's some adaptation there, whether it be on the bone, whether it be the actual skin itself getting thicker, or just the receptors, or all the above. The threshold on the receptors goes down, and so it takes a lot more force for that feedback to get back to the brain. So I think the same thing happens at the forearm. So just my own experience, when I first started kettlebell training, there was a certain weight. I think it was 28 kg that I could not rest on my forearm at all on both sides, and it would just make me let go of my wrist right away. Now I'm able to hold the 48 kg in a rack position on both sides if I wanted to. And I think it was just a function of very gradual progressive loading, and just getting those tissues adapted. But yeah, that is something to keep an eye out for, because if you have, let's say if you start them in a training program, they continuously have that and or like getting bruising on the back of the wrist, that can be an issue, and that's not a productive thing if it's been going on for weeks or months.
Yeah, it's good to know. I admittedly am not a kettlebell certified coach or practitioner, although I utilize kettlebell training a lot. But those questions do come up sometimes, and I wonder what would be the best course of action. So definitely helpful, and I'm sure for our listeners, something that they're probably taking notes on right now.
Cool.
Yeah, I really appreciate your insight overall, and I just wanted to know, now that 2022 is upon us, and like, is your daughter already 2?
She is, yeah, she's 2. She turned 2 in September.
That's
And
ridiculous.
yeah, it's crazy, man. You got to see her. She won't come out now, but it was like on the dot. I won't go too much into it, but it was like terrible twos. As soon as his birthday happened, it was tantrums going on like crazy, and she was saying no left and right. I was like, wow, this is really a thing, I guess.
Man, I'm glad. I think I'll take it from you when people tell me to take my time before I have children. This is also a call to action. If anyone wants to have children with me, I'm out here.
Nice.
Oh man, I mean,
Oh, man.
I wonder what kind of bites I'm going to get after saying something like that.
I can't wait to see.
Oh man. Dance? Anyone want to dance? I forgot this is a professional podcast, but going back to what we were saying before, it's 2022. What would you say that you have any resolutions or anything that you're looking to improve upon? Because for me, when people ask me what I'm going to do better next year, I literally just said this to someone. I'm like, I'm going to continue being who I am, because I have an operating system I feel that works. Obviously, I have goals that I plan to continue pursuing, but I think changing your action and your intention is the most important thing, but mine are already pretty straightforward, I think. Do you have any resolutions, or are you kind of on the same page?
Yeah, no, I mean, I'm kind of on the same page, but I would say one thing I'm realizing, I think both 2020 and 2021 keeps reinforcing, is the importance of time. And I would say for me, it's time with my family, and just being able to, have that time. I want to keep that. So I'm going to do anything that I can to maintain that. And also, as I'm getting older, I'm also realizing that I can easily get out of a loop to get into unhealthy habits, and I really want to maintain those healthy habits as much as I can, if not improve upon them. So I just want to be more diligent about that, and I think, like everybody else, the whole decrease screen time, increase sleep quality, better eating habits, drinking habits, things like that. That I think are super important. So just becoming more and more aware of that as I get older, and wanting to spend more time with my family, for sure.
I take that. I take that. I seen a lot of new parents, whether it's the product. I know yours was pre-pandemic, but I've seen a lot of post or during pandemic, because we're not out of this yet.
Yeah.
During pandemic babies, and they really are valuing the time with their family, and continuing to encourage me to do things like gymnastics and stuff, because they're like, well, it's going to be forever until I do gymnastics again or anything like that. And you know what they say about losing sleep, it's true. So I have a lot to look forward to, because I wake up tired on a couple of days. Not all the time. I don't want to make it sound like I'm chronically tired because I sleep well, but I'm definitely getting old, and I feel like if I don't get 8 hours of sleep a day, I'm like, I kind of suck. And some people are like, oh, all I need is 6 and I'm fine. I'm like, if that's actually the case, which science would disprove,
Yeah.
then more power to you.
No, I'm with you. I mean, sleep, it changes everything. Like we wake up when we have a bad night's sleep, where I'm totally different, and then when I have a good night's sleep, I'm absolutely totally on the other end. I could do so much, and definitely have a better mood, attitude, everything. So I hear you.
Cool. So if anyone else wanted to capitalize on your awesomeness and your insight outside of this podcast, where would be the best place for them to reach you at?
Yeah, you can go to Instagram. I have my handle as Movement Ryo Physio, and the whole thing is that um, Wei Chi Ru was one of the first martial arts I ever got involved in, and it literally means well, Ryu is when it's said in a certain way means the way of or the school of. So that was what I was trying to shoot for, the way or the school of movement, and then physio after that. So yeah, if you look that up, and movement is spelled MVMT, and then RYU, and then physio. So that's the best way. You can always DM me if you have any questions, and then my email's on there too if you want to click on the email button.
Yeah, I feel like removing all vowels from words is the thing now. They opened up this place called Dental Bar, and it's DNTL. It's like a walk-in like dentist over here. Yeah, I swear, I don't think that's the only place. I would be wasting too much time coming up with other places, but that one definitely stands out to me because I walk past it almost every day. I'm like, maybe I should just be JRDN, and that would be
There you go.
that would
Take out
actually
the
work. I
vowels.
think that would actually work.
That'd be awesome.
All right, Lee, do you have any parting words for our listeners?
No, I thank you so much for having me on, man. This is a huge honor, to be honest. And again, I'm super excited that there's more and more people like yourself getting the voice out and interviewing people from all walks of life. And yeah, I really appreciate it. And anyone who's interested in learning more about physio or strength training, you're the man to pass on the information. And this podcast, I think, is super important as well.
I really appreciate that. I have a great lineup of guests coming up after this from not even just physical therapy. They're actually not physical. The next that I can think of for January are not physical therapists. So it's going to be a lot of exciting information to come.
That's
But,
awesome.
but anyway, that's all we have for today, beautiful people. I again want to thank Dr. Scantalides for his time and insight. Now get out there and make shit happen.